All right. Well, welcome everyone back to our tiny training series. So excited to have everyone back. We're very happy to have you here. Today's training is on using telehealth services, and we're very fortunate to have our partner from Ally Health on with us today. And I'm going to introduce Jenny in just a quick second here. If you can all put in the chat your PS number or registry ID number and your name so that we can give you credit for being on today's training, that would be fantastic. So happy to have you here, and we're gonna move along. Just want to reintroduce you guys to our team here at 0 to 5. The team is here on the screen. Just remember that 0 to 5 is here to help you. We kind of have two sides to our company. We have a policy side and a program side. On the policy side, we work on systems building, policy support, and grassroots advocacy. And on the program side, we work on childcare capacity building and childcare business supports. And we are all here, the entire gang at 0 to 5 Montana, happy to help you. So Montana Child Care Business Connect, we are here to support 5 different cogs of a great big system wheel that we believe will help grow and expand providers here in the state of Montana. So we have interactive workshops. This is a part of that. We do business technical assistance, community capacity building, peer business mentoring, and web-based resources. And then this is part of our interactive workshops here. This is our tiny training webinar series. Attendance to 4 of our tiny trainings is going to give you 2 hours of ECP credits. If you log into your ECP account and get registered for this class, or if you have any issues, you can reach out to me. Attending 4 of these is going to get you 2 hours of ECP credits. So last tiny training, we did a quick introduction of what shared services is. And then today we've got Jenny from Ally Health, who's going to talk to us about telehealth services. And then after that, we've got substitute services, and Jacqueline is going to present all of our sub services. If you are looking for substitutes to help, we are here to help you with that. And then on the 27th of February, I will be back to talk to you about using childcare software, childcare management softwares, and how you can streamline your business using one. And then we are back on the 13th to talk about employee recruitment and retention with our beloved Beth, who's going to talk about how using shared services will help you with retaining and keeping your employees. What are the benefits of shared services? When you pool things together, you get a cost savings. This is definitely going to increase your operational efficiencies. This gives you an opportunity to collaborate with others in our field. It gives you creative buying power, and we're really excited about being able to offer group buying power through shared services. And then this helps create effective change in programs and communities. If you have any questions or you want to talk more to us about our shared services programs, I'd just like to highlight our shared services at 0to5.org, where you can put any questions or any thoughts in there for us, and we will be happy to respond to you. And then today, I just really quickly am going to make Jenny our presenter. I need to make her Jenny is going to share with the group today about Allied Health and all the wonderful benefits that Allied Health has to offer. And so I am going to stop sharing my screen and welcome Jenny Weaver. Jenny, hello.
Thank you, Kendra. Hello, everybody. Great to see you. I am loving being part of the shared services and really supporting you all in either individually getting access to care or as part of your little organizations across Montana. Just happy to help out, and I'm excited to share with you a little bit more about what Ally Health is all about and what you have access to, and whether you are currently enrolled and signed up with us or you want to be. Hopefully I can answer some questions and create some more visibility around the benefit being made available to you. So thank you again for having me, and I'm going to do a little screen share here. So I'm just going to walk through sort of why, oh, let's see what this is. Oh, wow. Okay. A little bit of who we are, what we do, and then more specifically to the services that are available to you through 0 to 5. And then I'll share with you next steps if you're not enrolled yet, how you do so. And if you are enrolled, if you don't know how to access Ally Health, we can talk about that too. So without further ado, we are a virtual care partner. At this point, COVID changed a lot of things, but even prior to that, we've really been in this sort of Instacart, DoorDash society. Some of you are in more rural areas, so you're like, what the heck are you talking about? But either way, we like Amazon Prime, right? We like things coming to our door. We're a lot more comfortable with that. And along with that is the comfortability in being at a distance and communicating. So whether it be with family or friends or with doctors. And that's really what Ally Health is. We are virtual care, meaning telehealth and virtual mental health services. So I'm going to walk through, again, what the plan that's available to you through 0 to 5, what is included in this plan. And there's one plan and everybody gets to enroll into it if you wish. So you have telemedicine. And this is 24/7, 365 access to board certified physicians. It's not a nurse hotline. It's literally access to doctors from wherever you are, whenever you are, which is great because I know you guys get snow and I'm here in Arizona and no snow. So there's no copay to use this service. It is family access, so literally household and dependents. Anybody who lives within your home or dependents outside your home, specifically like a college student, typically is what we see there. But again, access to board certified physicians, they can prescribe if it makes sense. So anything from an inhaler to amoxicillin to whatever antibiotics are typically needed. And the common conditions that we treat, and 94% of our patient medical issues are resolved through telemedicine, which is pretty cool. But these are the things that we see in our urgent care space. So sore throats, allergies, rashes, fevers, headaches, ear infections, sinus infections, constipation, stomach pains, UTIs, you name it. Anything you would go to a brick and mortar urgent care for, you can call us first or just use us. And there's no copay to use our service. And the prescription can be called into a local pharmacy that's best for you. So I've kind of already said some of these things already, but when you would use Ally Health, so instead of going to the emergency room for something that's non-emergency, so if it's, bleeding, chest pains, broken bones, go to the ER, right? Do not stop, just go straight there. If it's something else, like the things listed on the other column of common conditions we treat, use us, whether it's for you or a child or a significant other. Maybe a parent lives with you, great, use our service, and you never have to leave the house. So during normal business hours, even maybe you're at work and you're like, I just need to get a prescription sent in so I can pick it up on my way home. Great. You don't have to leave work to go to urgent care, take those 2 to 4 hours off, try to find coverage. It's just a nightmare, right? So it really helps with your own absenteeism as well as other people in your business to get care quickly and at a more convenient time for you. Sometimes we need to get in front of a primary care to refill a prescription and it just isn't lining up in our schedules, or it's the weekend and you ran out, or you lost your prescription, or you're traveling. Great, you can use us to refill a small dose of chronic disease management or things like that too. So it's all at the doctor's discretion, but really great way to access doctors very, very easily. The other part of this is for your mental health and wellness, and we love this. 50% of counties in the United States don't have access to providers at all when it comes to mental health. And I know being in more rural areas, that's speaking to you, as well as really recognizing that 1 in 5 adults in the United States have a mental health condition. 1 out of 6 adolescents. So our services provide scheduled talk therapy as well as short-term counseling, and I'll get to that in a second. So the scheduled talk therapy included in your plan, there's 10 sessions included with a $0 copay per family per plan year. And then there's a $90 copay thereafter. All of these sessions are virtual and they are scheduled, so you can get ongoing treatment and work with the same therapist. These are licensed clinical social workers, psychologists, and we have psychiatrists in this plan as well. It's by appointment only. I already said ongoing care, and it's available through mobile app, website, or phone. So you can talk to the providers in whatever way is best for you. And dependents down to the age of 10 with a parent or guardian approval can also use these services. So our kids are really struggling right now. Obviously, you guys are in a space where you're working with a lot of kids. This is a great way to help them too. Your children, anyway. Common issues that we treat in this space, substance abuse, relationship, marital issues, you name it, all sorts of things in this space. Things like ADHD typically are for in-person care, so we can't do a whole lot there, but you can always start with us, and they're like, oh, you really need to see a provider in person? Great, at least it didn't cost you any money and you didn't have to go anywhere. So I like using Ally Health as triage in some cases, just to see kind of where we're at and then be able to get referred out from there. For the short-term counseling and the daily support and coaching, these are some of the reasons why you would use these services. So 24/7, 365 in the moment counseling. This is like, I'm in an anxiety crisis. I'm in a depression fog. I need to talk to somebody right now. I can't wait to schedule it. I need to talk to a counselor right now. I'm having a tough time. Great. We got you. And that's you, that's anybody in your household, and that's any dependents outside the home. Again, no copays to use this service. Really ideal for short-term resolution. So if you need that ongoing care, you can plug into the previous slide. But if you just need to talk to somebody, just a soundboard, maybe it's about finances, maybe it's a legal question, maybe it's literally like in a mental health crisis, we've got you. We also offer coaching, which can be ongoing, like I want to be more healthy, so nutrition, or I want to quit smoking, or I just want to have some better habits, or maybe life coaching or career coaching. All of that can be found through our coaches here, and there's a weekly session set up with those people. So tons of availability for mental health and wellness. You have a savings tool for medical bills over $500. Our third-party team can help negotiate those down, so it helps with some savings there. Plus a prescription savings plan. So if you don't have insurance and you're paying out of pocket for prescriptions, or even if you do have insurance and your deductible or your copay is high, you can always check with our digital coupon book and see what's cheaper and go that route. So that's pretty cool. When you enroll in our service, you'll be live typically the first of the next month. So next steps for you, and I will answer questions in just a second, is on your trusty website here. There's a little overview of the service, but the enrollment form is actually right here. You just click and fill that out, and you get up and running. Make sure to pay attention to some deadlines for enrollment if you really want to be live by the first of the following month. But otherwise, you can just click enroll there and get set up and ready to go. It's not listed on here specifically, but it's $12 per month based on the, I'm sorry, per person or per family per month. $12 is the membership, and then the access is $0 copay. And this is all set up because of the partnership we have with 0 to 5.
Oh, that's wonderful. Thank you so much for all of that information, fast and furious. We know these tiny trainings are short and to the point, but we want to get all the information out that we possibly can. There are a couple of questions, Jenny, in the chat. The first one is the copay $90 after the 10 sessions?
Yes.
Perfect. Are there any other questions? You guys can come off mute and ask Jenny anything while we have the expert on with us.
Or if you're just excited, I like hearing that too. Questions. Do you think this is awesome? I think it's awesome. I love my job. So
I do too.
I have a question.
Yes.
We're having difficulty receiving the welcome emails to our staff. And I'm trying to figure out how we're having difficulty getting that even so that they can register. We've enrolled, but there's a couple that have gone 2 months without being able to register. And I'm trying to figure out how to contact someone at Ally Health or some, I'm just need some support that way.
Okay. And Denise, I'm sorry that that's happening. So, the great news is that once your employees or you are enrolled, after the first of the month, even if you don't find that email like in junk or spam, and I will have another
Okay.
solution for you too, but you can
Cool.
actually go to allyhealth.net,
Okay.
register, and you just plug in its last name, zip code, and birth date. And
Okay.
activate your
Okay.
account. You don't need anything from us. So that is
Perfect.
open.
That's kind of what I was wondering. If there was a more direct way that, because I don't know, you never know about firewalls and things like that, but
Yep,
it
you can just do that. It's pretty easy. And then if they can't be found at that point, then we do need to help out.
okay.
I will actually, will you put your email in the chat, and I'll send
Yep.
you a one-page activation form that you can just share with your
Perfect.
team, and they don't have to wait for our emails then.
Perfect. That sounds great. Thank you so much.
Yeah,
Appreciate it.
absolutely. And I will put the support email in here because if anybody else needs it. So it's just
Awesome.
support@allyhealth.net. And our team is on there Eastern time, but it's basically 8 a.m. to 5 p.m. Eastern time. And they're watching that inbox regularly to help out for things like this. So
Perfect.
Jacqueline, and you said, is there a copay after initial 5 wellness visits? No, there's never a copay on the coaching or the short-term counseling.
Oh, thank you.
And there's never a copay on the urgent care either.
Okay, perfect. Thank you so much, Jenny. That's great information for our people. I'm going to hand the slides over to Jacqueline now, who is going to share with us just a couple of quick things.
Yeah, thank you, Kendra. Thank you, Jenny. Just to dive a little bit further into our enrollment process for for telehealth services. Like Jenny was saying, you'll go to the Business Connect website for 0 to 5. Once you're there, you'll click on the resource tab and then click down on shared services. Once you're on that shared services page, if you scroll down a little bit, there'll be that enrollment form. That is for programs that are not currently on telehealth services that would like to sign up for telehealth services. Once you've clicked on that, like Jenny was showing, this form will pop up, and just kind of want to give a little bit more in-depth details on what information we do need to have for our systems and for telehealth for Ally Health. The person who oversees the billing, if you could use their email address in the director's email, or put it in or put it in with the where you list the employee enrollments. The format that we need to have the employees' information, the enrollment and enrollees information is last name, first name, / gender, / date of birth, / enrollment date, / address, including city and state and zip code, and then / email address and / phone number. If you could separate the enrollees by a semicolon, it really helps when we're building out our spreadsheets to keep track of enrollments. Just to reiterate what Jenny was saying about deadlines, telehealth enrollments are billed 1 month in advance. Enrollments and updates to enrollments for telehealth need to be into us by the 5th of the month. If you would like services for telehealth services, if you'd like services for the following, for the following month. Gets a little confusing, but if you have questions, please reach out. Invoices will be billed out on the 10th, and payments are due on the 15th, so we can also accommodate Ally Health's billing schedule, and we don't have to hold up their process as well.
I don't know what happened there. Hold on just a second. Okay, so Jacqueline, did you have anything more? Did you freeze?
I'm still here.
Okay, perfect.
Nothing else.
Okay, so what I do want to share with everyone on the group today is that if you are interested in signing up for telehealth, Jacqueline is our shared services guru. And you can always reach out to Jacqueline at any point and any time with any of your questions. She's happy to help and happy to get that info out to you guys. What I'd like to do now is to just open up the floor really quickly to see if there's any other questions. Becky, we can get that sent over to you. But if there's any other questions that we didn't address, we want to give you guys time. This is your time to ask the professional. So we're just going to pause for a second and give you a chance. Okay.
Kendra, it looks like we have a question in chat from
Okay.
Melissa White that
Okay.
they wanted to know if it's $12 per month.
I'm going to pass that to you or Jenny.
Okay, okay. Sorry. Yes, it's $12 a month per person. And that $12 does include up to 5, and Jenny, correct me at any point if I'm not don't have the correct information. That $12 covers the primary member and up to 5 dependents as well.
Nailed it. And dependents don't have to be legal dependents. It's household and dependents. Great job, Jacqueline.
Thank you, Jenny.
Okay, well, we're going to finish up today with just a couple of quick announcements. I have a couple very exciting things. Remember that our next Tiny training session is on February 13th, and it's on substitute services with Jacqueline. I also just want to remind everyone that we do have next week coming up here at our state capitol, our Have a Heart for a Kids program. And if you're interested in supporting us and helping our policy team encourage our legislators to keep childcare initiatives in mind, we encourage you to register. You can still register for this event. That registration will be open through the end of this week. So make sure you jump in and take care of that. And then Beth is launching her second cohort for our recruitment and retention. Her Leaders Revitalizing cohort is coming up. Application for this cohort is open. If you know someone who can benefit from this, this cohort is for group and center providers. And we'd like you to please just click on this QR code or the link and go fill out that application. Feel free to share this information with anyone out there who might be interested. We wanted to let you all know that we extended the deadline for our employer-sponsored childcare grants. If you plan on partnering with an employer in the state of Montana to help you, click on this QR code and take a look at this grant, see if it's a good fit for you and what we offer. And then, like always, we want to encourage all of you to follow us on our socials. Sign up for our newsletter. It's the best way to get all of the information that we have to offer. And then lastly, but not leastly, we want to ask you how we did. I put the link and the QR code in there for you today. You can fill out this questionnaire. Also, if you have an idea for an upcoming Tiny training and you'd like to learn more about something, you can also put that suggestion in there. And I am going to end tonight with just leaving me and Jacqueline and Jenny on for a few minutes. If you have a couple extra questions and needed to ask us, we're still going to be here. But otherwise, I just want to say thank you to everyone and to let you have a great day.
Thank you.
Thanks, Caitlin.